There's a wide variety of symptoms that can indicate that a patient has lymphoma. Anything from a painless lump, which can be in the neck, under the arms, in the inguinal region where lymph nodes normally occur, through to a patient who has profound weight loss, night sweats, and really feels very unwell. So on the one hand, a patient can feel perfectly well and just notice a small lump, through to a patient who clearly has something quite wrong with drenching sweats, weight loss and fevers. So the symptoms can be very vague, and when patients finally come to diagnosis, which must be made through a lymph node biopsy, it's often quite a shock to them that they have a malignant disease. If all they've had is a painless lump and they've been carrying on quite normally in terms of their function, then it's quite a shock to find they have a malignant disease, which is often incurable. Lymphoma is a complex disease. It's actually an umbrella term that really encompasses a wide range of specific subtypes. There are more than 30, in fact, subtypes of lymphoma, and it's very important for clinicians to categorise them into the very specific subtypes because many of them have very specific treatment needs that differ from one to the other. But for patients, it's sometimes quite difficult to learn that they have lymphoma, the same as many other patients in the waiting room, but a very special subtype that might require quite different therapy. There are a range of different treatment responses to lymphoma, and in fact there's a huge range in the types of therapies different patients require, depending on the specific subtype of lymphoma they have. So treatment can in fact range from simply watching and waiting, where no specific therapy is administered, all the way through to very aggressive treatment, which includes intensive chemotherapy and sometimes bone marrow transplant. So we run the full gamut of treatments for this disease known as lymphoma, which I stress is really a number of very different entities. Lymphoma is the most common form of blood cancer in Australia, much more common than leukemia. It's about the 6th most common cancer overall, including the common epithelial tumours like breast cancer, etc. The important thing about lymphoma, though, is that it's increasing in incidence and at quite an alarming rate. The incidence has actually doubled over the last 20 years, and we're seeing about a 3 to 4% increase in incidence annually. So that's a very worrying trend, quite an alarming trend, and clearly begs for more work to be done in this area. The reasons for the increase are really quite poorly understood. We know that there are a number of risk factors for lymphoma development, but none of these, or cumulatively, account for the alarming rate of increase in the incidence of the disease that we're seeing. The development of lymphoma at the molecular level within the cell is really very complex. But if I could simplify it to let you think of a lymphocyte as a cell that grows up from a primitive cell to a mature cell and has many different stages along the way. And depending at what stage that particular lymphocyte is in its development, that something goes wrong in the cell, it leads to a different type of lymphoma. And the sorts of things that go wrong in the cell in some subtypes are quite well understood, and they're usually involving actual genes that rearrange themselves for one reason or another and lead to the development of lymphoma. But there are many subtypes in which the specific molecular aberration that leads to the tumour are really quite poorly understood. But there's a lot of medical research happening in that field, and as we understand the mechanism of the development of lymphoma, we will be able to devise better treatment strategies to try and counteract those changes. One of the slow-growing types of lymphoma, which is in fact one of the most common subtypes, known as follicular lymphoma, arises because of a failure of the lymphocytes to undergo normal cell death. All our cells in the body are programmed to die at some particular point. And in this particular lymphoma, there's a genetic rearrangement which overproduces a particular protein that allows those cells to go on surviving. So in fact, one of the key elements in the development of lymphoma in that case, follicular lymphomas, is a failure of the cells to die rather than an abnormal growth as such. So that's a very different mechanism from some of the other cancers that we know, and just underscores the importance of really knowing what the molecular pathogenesis is so that in the future we can target that mechanism for therapeutic purposes. Well, if we think of it in a historic perspective, at the beginning we only had radiation therapy and a few patients benefited from that. The next breakthrough was the advent of chemotherapy, single agents and then combinations of chemotherapy. That was really a significant breakthrough in the 70s, where we were seeing a significant number of cures in those patients. But in the recent times we've seen really a huge advance, a major breakthrough with the development of immune therapies. These are engineered antibodies that can specifically target the lymphoma cells and cause cellular death of those specific cells, not affecting other cells in the body. And this is a huge breakthrough in that it's a totally different way for treatment to work. We've seen these therapies tested in the clinic over the last several years, and enormous benefit in terms of both survival and time in remission is occurring in patients with lymphoma. Research in the area of lymphomas is certainly increasing, but we have a long way to go and we need a lot more resources being poured into this disease, which after all is one of the most rapidly increasing cancers of them all. We are fortunate in that there has been some progress, and we expect new therapies to be tested in the clinic as a result of those over the coming years, but we certainly have a long way to go before we are going to be able to eradicate this problem. And support of medical research in the lymphoma area is critically important globally. Certainly patients with lymphoma today have a better outlook for survival than they did, say, 20 or 30 years ago. Even taking into consideration the many different subtypes, and the answers for each of those subtypes is different. If we take a global view, there's no question that more patients suffering from lymphoma will survive the disease today than in the past. And much of that survival benefit has been due to the therapeutic breakthroughs, specifically the targeted immune therapies.